Home visits are a daily routine for Linda Akinyi and her colleague. They're doing outreach work for the Kenya Medical Research Institute. They've selected certain households for malaria testing and monitoring. Today they're visiting Beatrice Okello.
Okay, I want to test her for malaria and anemia. We'll get the results now.
In Western Kenya, the risk of contracting malaria is high. Statistics show a little over a quarter of the population in the region is infected. The national average is 8%. Beatrice Okello says she and her family get sick every couple of weeks. She sometimes visits the hospital for treatment. Usually, though, she just goes to the pharmacy for medication. The children are up next for testing. The health worker has good news for Beatrice.
So we've just done the first response RGT for malaria, and the results are already out. It's negative. So she has no malaria.
But Michael, the youngest child, tested positive for malaria, even though he doesn't have a high fever or other obvious symptoms. Due to constant exposure to the virus, he may have developed some immunity, but he still needs to be treated. Cases like Michael's are common in the region. That's why the blood samples have to be sent to the lab for further testing.
In this region, since it's a malaria endemic area, most children do have the parasite with them, but there are no clinical features. So you can get some sample in the lab, you do the microscope, and you find they have so many parasites.
The laboratory at Siaya Hospital is on the front line of the fight against malaria in Kenya. Researchers here study the behavior of the malaria parasites and test new strategies to eliminate the virus. For them, cases without any obvious symptoms represent a huge challenge.
So a large proportion of the population, upwards of 90% of the people who have malaria infections in their bloodstream, won't have any symptoms, and if they don't have symptoms, naturally they won't go to a health facility to be treated. Despite that, they are still capable of transmitting malaria parasites to mosquitoes, and therefore they can also cause a problem in the transmission cycle.
That's why preventing new infections is key. Back in the villages, the outreach workers check the use and condition of mosquito nets in people's homes. Most people get their insecticide-treated nets from clinics or from the government. Esther Olu lives here with her husband and grandchild. She says the family follows strict rules to prevent them from contracting the malaria virus.
We usually cook earlier, before it's dark. And you know, in the kitchen, because of the smoke, the mosquito fears smoke. So from the kitchen, we normally come, and even if I want to read my Bible, I read it when I'm already covered with the net in my bed.
Although not everyone is as diligent as Esther Olu, malaria prevention awareness is growing. The hope is that safe practices, along with treatment and perhaps the development of a suitable vaccine, may help the number of malaria cases in the region to drop.